Hello class, this is Amy Brooks. I wanted to go over our spring 2025 case study. I know we're all reading the same ones, but I know we'll all have a different point of view, so I'm excited to hear yours. So what factors from Michelle's early childhood have led her to develop her maladaptive coping mechanisms? There's a few, as you can see, that I found. Her father was angry, impulsive, verbally and emotionally and physically abusive. He was overcritical and volatile with his temper, and he forced her to always follow his orders, which caused her to kind of have a lack of autonomy, it seems like, in her life. She took on the role as the companion emotionally and socially with her father because of her parents' marital problems. Michelle's mother was emotionally and physically absent due to her own mental health and physical health problems. She felt her mom did not like her or want her for many reasons, which were felt throughout her mom's behavior and her words and her actions. She became her mom's caretaker at a young age, which is not the child's job, as we know. And her mother's absenteeism contributed to Michelle's sense of defectiveness and inadequacies and feelings of shame. And then this is, I think, also where her deep-seated anxiety and depressive problems may stem from as well. And through her siblings' behaviors, she began to feel like a scapegoat of the family, and maybe that she wasn't good enough for them as well. Her siblings constantly bullied her by calling her fat and stupid, which seemed to wear on her self-image and self-esteem. And they were also physically abusive to her by reprimanding her over little trivial things like biting her nails or asking for help. And this became apparent in Michelle's therapy sessions when she was struggling with asking for help for that deep-seated anxiety and depression, because she was raised to be independent, unseen, and was reprimanded when she needed help. So all of these relationships left her constantly seeking love and attention, and at the same time feeling worthless and unwanted in relationships, it seems like. Which negative coping mechanisms can you identify in Michelle? So she internalized her feelings, which caused some GI somatic symptoms, which could have possibly resulted in unnecessary surgery. She developed high-risk sexual behaviors and increased promiscuity in her relationships. She started abusing alcohol and THC in her adolescence. For mental protection, she developed denial and projection defenses, especially towards her mom's behavior. And she developed paranoia. She lived life trying to be in control. This paranoia is apparent in therapy as she relayed fears that someone would break into her home and strangle her. And this fear stemmed from multiple childhood traumas and assaults while she was in her home, where she should have been safe. So she did a lot of blocking out of childhood details, so she developed some repression of memories as a coping defense. And in the therapist interview, she recounted crying daily through the age of 19 and feeling just a desperation for someone to listen to her. So she feels so desperate, such a desperate desire for love and belonging that it consumes her. She seeks it even when it's in a negative manner or an unhealthy attention and love. And this relationship with her mom, despite feeling safe, or despite the failed safety and love, led her to an ambivalent attachment pattern in relationships, feeling insecure, having difficulties with separation, having problems with feeling soothed and safe even when she was not separated, as well as anxiety and worry or confusion of her, like thinking about what her worth was in the relationship. When she feels emotionally neglected in these relationships, she then becomes defensive, demanding, argumentative, trying to gain some sense of control, and tries to just get even sometimes with those she loves. So an example of this was in a therapy session at the 6-month mark when her therapist told her he'd be gone on vacation. Instead of being understanding, she kind of had a negative reaction towards the therapist, as if she didn't need it at all and that she was done with it. So these are all signs of emotional and physical abuse, and that they could have contributed to even her suicidal ideations and bulimia. So throughout this therapy sessions, there's also this transference which grew to where she constantly needed the therapist to mirror and evaluate her experiences and tell her what she would want. Oh, can you identify any aspects in your current relationships with others that may have arisen because of the significant past relationships with your parents or siblings when you were growing up? I mean, who can't? Yes, there are aspects in my relationships that are deeply affected by the way that I was raised. My parents were also very critical. They were transactional with their love and emotions, and they were dismissive about our own feelings and needs. To this day, I feel like I don't know how to react to other people's emotions. I saw this thing once, it was a picture, somebody was crying, and there's like a guy with a broom tapping on her shoulder saying, "It's okay." That's kind of how I react to people's emotions sometimes. I'm getting better. But my father had a narcissistic tendencies, and he was kind of hard to relate to, and he really loved coming home and riling up my mom over trivial things like a dirty dish in the sink. My mom was emotionally unpredictable. She could go from happy to screaming to like getting on to you physically, and then trying to love on you all within, sometimes the course of an hour. So my three sisters and I, we felt like we walked on eggshells just trying to not tip her off, which kind of makes you very anxious. And looking back at my previous marriage, I definitely married the combination of my mom and my dad when I was 18. And so that was, further supported that emotional purgatory, as I call it. But all of these circumstances definitely can make me distant at times, and I pull away when I get concerned or I get stressed about things. I get quiet, but I am aware of this emotional reaction, and when I am triggered in my current relationship, in my current marriage, I try to really remind myself that I'm safe and supported and loved and worthy, and he's not going anywhere. But it is a constant daily process that I just go through and I work on it. Are there any problems in your life that you think psychodynamic psychotherapy could help you deal with? Absolutely. I am an avid supporter and promoter of counseling and therapy. Um, I wish every teenager would go through it. It would help so many people. There are multiple areas of my life that I currently see a therapist for. I just started actually, but I wish I would have done it years ago. And there is some trauma that has shaped who I am as a person, and so that is stuff that we just talk about, and that's, for me, the most helpful thing is to get it out of my head, to just talk about it, and that way I can kind of wrap it up in a bow and move on from it. But I love cognitive behavioral therapy. I'm really looking into the EMDR, but yes, I think the answer to this is absolutely. What psychiatric medications, if any, may be helpful? So she has been in therapy for a while, and I think for her that is the most crucial aspect to her healing, is maintaining that therapist. But since she's still having some anxiety and panic symptoms, and some depressive symptoms, I would consider starting an SSRI as an adjunct to her treatment. As we know, those are the first line for anxiety and depression. And I think, sertraline, escitalopram, fluoxetine, any of those would be good first line medications for her. I'd have to get some, more background before really deciding which one. And I really like the picture of this succulent on here, because I just think about just succulents take such little love and nourishment to stay alive, and yet they still grow to be beautiful, unique, colorful things that just really make us happy and brighten the world. So that's why that random picture of a plant is on there. Choose one of the goals of the treatment and analyze it. How might you help Michelle reach this goal? So the constant theme I read throughout her story was relationships kind of coming and going and really affecting the way she was. So while all of those goals were important, I feel like beginning on a solid relationship foundation is crucial. So A is going to be, for me, the most important, developing that working alliance. The therapeutic relationship between patients and care providers is often a known predictor of compliance and engagement in a therapeutic interventions and overall mental health outcomes. So I really feel like that for her is going to be the biggest predictor of her health. And I feel like it's important to establish that strong therapeutic working alliance with our clients. Though we may have a heavy schedule, we need to just make sure we're not rushing things, we're not making them feel, not validated, that we're allowing them plenty of time to talk and answer their questions and concerns within reason, obviously, and then just setting those boundaries with them and those routines that they know where they lie within those boundaries, I think are important. So that's the one that I would choose. A few last points. I think all of these bullet points are really important, and that's why I laid them out on a slide together. I just feel like she didn't get those basic relationship, love, attention, emotional support that she should have growing up, and if anything, she got the opposite. And so it really set her down a pattern of just trying to survive, emotionally treading water, it seemed like. But I really just wanted to put these all on one point so that you had them. So here is my references, and I really appreciate you taking the time to listen to me, and I can't wait to hear the rest of yours.